When most Americans hear the words El Niño or La Niña, they think of rain, snow, or perhaps hurricanes. Few immediately connect these climate cycles to their personal health or safety. Yet the El Niño Southern Oscillation, or ENSO, exerts enormous influence over the conditions in which we live, work, and protect our families. ENSO is not simply a matter of whether crops flourish or whether California gets more rain. It is about the intensity of heat waves that strain vulnerable populations, the timing and severity of flu seasons, the spread of mosquito-borne illnesses, the contamination of urban water supplies after floods, and the destructive fires and storms that dominate the nation's news cycles. In truth, ENSO is one of the most powerful but least understood forces shaping American lives, dictating risks that range from disease outbreaks to natural disasters. Understanding these connections is not only a scientific matter, it is a public health necessity. Heat waves are perhaps the most obvious way ENSO influences human health. During strong El Niño events, much of the southern and western United States experiences hotter than average temperatures. This heat puts enormous strain on vulnerable populations, the elderly, children, and those with pre-existing medical conditions. Hospitals see spikes in cases of heat exhaustion, dehydration, and cardiovascular stress during prolonged heat waves. Cities like Phoenix, Dallas, and Los Angeles routinely report higher emergency room visits in El Niño summers when heat waves arrive earlier and last longer. La Niña years, by contrast, often bring scorching conditions to different regions, particularly the southern plains and the southeast. In both cases, communities unprepared for extreme heat find themselves struggling to cope. For households without air conditioning, or for those who cannot afford higher electricity bills, these ENSO-driven heat waves are more than uncomfortable. They are life-threatening. Researchers have documented thousands of excess deaths across North America during past ENSO events linked to extreme temperatures. Flu seasons, too, are shaped by ENSO in ways that most Americans never realize. Scientists have found correlations between ENSO cycles and the severity and timing of influenza outbreaks. During El Niño winters, warmer conditions in parts of the country often shorten the cold season, but create fluctuating humidity that helps influenza viruses spread. Conversely, La Niña winters bring sharper cold snaps in the northern US, extending the window for flu transmission. Public health researchers at institutions like the National Institutes of Health and the Centers for Disease Control and Prevention, CDC, have begun integrating ENSO data into their models of flu season risk. The timing of vaccine distribution, the scale of public health messaging, and even hospital staffing patterns are increasingly informed by these forecasts. For ordinary families, this means that ENSO can quietly dictate whether a flu season is mild and manageable or severe enough to fill hospital wards. It is not coincidence that some of the worst flu years in recent memory coincided with notable ENSO events. Mosquito-borne illnesses provide another direct link between ENSO and health. Diseases like West Nile virus, dengue fever, and even the threat of Zika are all influenced by the rainfall and temperature swings that ENSO brings. In El Niño years, wetter conditions in the southern US can create more standing water, ideal breeding grounds for mosquitoes. Warmer temperatures then accelerate mosquito life cycles, leading to larger populations and higher transmission rates. La Niña years, while often drier in some regions, can shift rainfall patterns so that outbreaks occur in areas unaccustomed to them. Public health departments across states like Florida, Texas, and Arizona are acutely aware of these risks. Surveillance programs ramp up during ENSO years, known to favor mosquito expansion, and municipalities spend millions on spraying campaigns, larvicide treatments, and public education. For families, this means more warnings to wear repellents, limit outdoor exposure at dawn and dusk, and eliminate standing water around homes. The fact that a patch of ocean thousands of miles away can influence whether mosquitoes thrive in your backyard underscores the hidden health dimensions of ENSO. Floods, another ENSO signature, carry risks beyond property damage. They are public health events in their own right, exposing cities to water contamination, mold, and infectious disease. El Niño winters often funnel storm tracks across the southern United States, bringing torrential rains that overwhelm drainage systems in cities like Houston, New Orleans, and Atlanta. When sewers overflow and treatment plants fail, contaminated water infiltrates streets and homes. Outbreaks of gastrointestinal illnesses often follow, particularly in vulnerable communities with aging infrastructure. Residents wade through floodwaters without realizing the stew of pathogens they contain. Even after waters recede, mold grows rapidly in soaked homes, triggering respiratory issues for months or years. La Niña floods in the Midwest and along major rivers carry similar risks, spreading agricultural runoff and industrial pollutants across entire watersheds. Public health agencies often scramble to provide clean water, mobile clinics, and shelter for displaced families. For many Americans, floods are remembered for their destruction of homes and businesses. But for those who live through them, the lingering health consequences can be just as devastating. The intersection of fire season in the west and hurricane season in the east is one of the starkest examples of how ENSO divides the country. During La Niña years, the western US tends to dry out, creating perfect conditions for wildfires. Entire communities in California, Oregon, and Colorado brace for fire season when La Niña takes hold, knowing that one spark can ignite a disaster. These fires do not only destroy property, they poison the air with smoke that blankets states for weeks. Hospitals report surges in asthma attacks, bronchitis, and cardiovascular distress during smoky summers. Children and the elderly are particularly vulnerable, and the smoke can travel hundreds of miles, affecting people far from the flames. Meanwhile, in those same La Niña years, the Atlantic hurricane season ramps up. With reduced wind shear and warm waters, hurricanes form more easily and more powerfully. The Gulf Coast and the eastern seaboard face heightened risks from Florida to New York. Hurricanes bring their own health crises: injuries during evacuation, waterborne diseases from flooding, mental health struggles in the aftermath of destruction. In this way, ENSO splits the nation's disasters: fires in the west, hurricanes in the east, forcing Americans everywhere to face different but equally dangerous threats. The mental health toll of ENSO events is often overlooked, but deserves attention. Families displaced by floods or hurricanes endure not just the loss of property, but the trauma of survival. Children suffer disruptions in schooling, and parents struggle with uncertainty about the future. Wildfire survivors in the West experience long-term anxiety every time smoke returns to the sky. Even those not directly impacted may feel the stress of rising prices, disrupted communities, and constant news of disasters. Psychologists emphasize that climate-linked events like those driven by ENSO are catalysts for widespread mental health struggles, from anxiety and depression to post-traumatic stress disorder. These issues ripple across entire regions, compounding the physical health effects of heat, disease, and disaster. Cities across the US are beginning to adapt, recognizing that ENSO cycles cannot be ignored. Public health departments integrate ENSO forecasts into disease monitoring systems. Hospitals adjust staffing levels based on expected flu surges. Utilities prepare for heat waves by reinforcing power grids, and cities strengthen flood defenses when El Niño looms. In the West, fire preparedness campaigns are tied to La Niña advisories, urging homeowners to clear defensible space and prepare evacuation kits. Along the East Coast, coastal states pre-stage supplies when NOAA predicts an active hurricane season. These efforts are far from perfect, but they represent an important shift. ENSO is no longer just a scientific curiosity. It is treated as a fundamental risk factor for public health and safety. Still, the challenges remain vast. America's infrastructure is not equally prepared to handle ENSO's swings. Wealthier communities can afford stronger defenses and quicker recoveries, while low-income neighborhoods suffer longer and more severely. Heat waves hit hardest in areas where air conditioning is scarce. Floods devastate communities without robust drainage systems. Fires consume homes where residents cannot afford fire-resistant retrofits. Hurricanes destroy neighborhoods where insurance is unavailable or unaffordable. In all these cases, ENSO exacerbates existing inequalities, widening the gap between those who can adapt and those who cannot. Policymakers are increasingly aware of this, but solutions are costly and politically difficult. For individuals, the lesson is that ENSO is not an abstract term buried in weather reports. It is a driver of daily risks to health and safety. It is why heat waves come earlier, why flu seasons seem harsher, why mosquitoes appear in greater numbers, why floods leave neighborhoods unlivable, and why disasters on both coasts grow more intense. Recognizing ENSO as a health and safety issue helps families make informed decisions, whether to prepare for extreme heat, seek vaccines earlier, eliminate mosquito habitats, or heed evacuation warnings more urgently. For the nation, it underscores the need for robust investment in climate science, resilient infrastructure, and public health systems that can handle the shocks ENSO delivers. ENSO will continue to cycle, as it has for centuries, but its impacts are being amplified by climate change and by the vulnerabilities of modern society. Each El Niño or La Niña is not just another chapter in weather records. It is a test of the country's ability to protect its people. From the silent spread of disease to the visible fury of hurricanes and fires, ENSO shapes American lives in ways both obvious and hidden. The challenge is not to stop ENSO, which is impossible, but to prepare for its consequences, reduce its toll on health and safety, and recognize that this cycle in the Pacific Ocean is, in many ways, one of the most powerful determinants of American well-being. The health and safety consequences of ENSO become clearer when we examine its fingerprints across specific communities and systems. Start with heat waves. These are not just meteorological anomalies, but acute public health crises. During strong El Niño events, much of the South and West experience hotter summers and autumns. Emergency rooms fill with patients suffering from heat exhaustion, kidney stress, or heart failure brought on by high temperatures. Cities with aging populations like Miami or Phoenix see mortality rates climb during these episodes, often quietly, as vulnerable individuals succumb in apartments without reliable cooling. Even in La Niña years, when heat shifts more toward the south and Great Plains, the same dangers arise. Workers in agriculture and construction face dangerous conditions, with more cases of heat stroke reported by occupational health clinics. These outcomes underscore how ENSO is not a distant phenomenon, but a direct influence on who lives or dies in an extreme summer. Hospitals and city governments now track ENSO advisories to anticipate how much demand they may face when the next heat wave arrives. ENSO also touches the less visible world of infectious diseases. Influenza is a prime example. When scientists compare decades of flu season severity with ENSO cycles, patterns emerge. El Niño winters often coincide with altered humidity and temperature conditions that boost flu transmission in some regions. La Niña winters, on the other hand, prolong cold spells in northern states, extending the season for influenza to thrive. The result is that ENSO phases can serve as predictors of how severe a flu season will be and when it will peak. For the CDC and hospitals, this knowledge is invaluable, guiding vaccine production schedules, distribution campaigns, and even staffing decisions in emergency departments. For families, the result is more personal. Whether flu strikes early, whether schools are disrupted, or whether vulnerable relatives face heightened risks. Few people think of the Pacific Ocean when flu season arrives, yet ENSO quietly shapes the intensity of outbreaks that sweep through American households. Vector-borne diseases present another dimension of ENSO's health reach. Mosquitoes thrive in the wetter conditions often associated with El Niño. Ponds, ditches, and flooded backyards become breeding sites, fueling the spread of West Nile virus, or in rare cases, imported threats like dengue or Zika. Public health departments in states like Florida, Louisiana, and Texas intensify monitoring during such years, deploying additional spraying programs and issuing more public advisories. La Niña does not always reduce the risk. Instead, it shifts rainfall patterns, creating new mosquito habitats in regions less accustomed to managing them. Scientists warn that climate change combined with ENSO variability could expand mosquito ranges further into the Midwest and even northern states. For local families, the outcome is more mosquito bites, greater exposure risk, and the stress of living under advisories that limit outdoor activities in summer evenings. ENSO, again, is the hidden architect behind patterns of risk that appear seasonal, but are in fact global in origin. Floods triggered by ENSO have both immediate and long-term health implications. Torrential El Niño rains frequently overwhelm urban drainage systems, leaving raw sewage mixed with floodwater in cities like Houston, Baton Rouge, or Los Angeles. Residents who wade through or accidentally consume contaminated water face risks of gastrointestinal illness, skin infections, and even rare but deadly pathogens. In rural areas, floods wash agricultural chemicals into rivers, polluting drinking supplies for downstream towns. Once the waters recede, mold becomes the next threat. Families forced back into damp homes often develop respiratory illnesses that linger for years. Children are especially vulnerable, with higher rates of asthma diagnoses after major flooding events. La Niña floods across the Mississippi or Missouri rivers present similar dangers, especially as runoff from farms and industry mixes with floodwaters. These crises reveal how ENSO does not simply damage property, but attacks the very systems that sustain human health: clean water, safe housing, and breathable air. The contrast between fire and hurricane seasons illustrates ENSO's geographic duality. During La Niña, the West braces for wildfires. California towns like Paradise, Redding, or Santa Rosa know that when ENSO leans toward cooling, drought will likely intensify, leaving forests dry and combustible. The fires that follow bring not just flames, but massive smoke plumes that spread across states, choking communities with hazardous air. Hospitals record spikes in respiratory distress, asthma attacks, and even cardiac emergencies as fine particles lodge in lungs. Meanwhile, the eastern Gulf coasts contend with ENSO's other side, hurricanes. La Niña seasons reduce atmospheric wind shear, giving storms in the Atlantic the chance to grow stronger and more frequent. Katrina, Harvey, and Ian all developed in such contexts, inflicting not only economic damages but severe health crises. Evacuations displace vulnerable populations, storm surge contaminates water supplies, and power outages cripple hospitals and dialysis centres. ENSO divides the nation's hazards: flames in the west, floods and winds in the east, both deadly in different ways. Mental health is an often overlooked casualty of these ENSO-linked disasters. Families that lose homes to floods or fires carry trauma long after the news cameras leave. Survivors of hurricanes endure not just the loss of property, but the anxiety of every future storm season. Children suffer educational disruptions, while parents juggle the strain of rebuilding with the uncertainty of recurrence. Even those far from the disaster zone feel the stress of rising costs, constant headlines, and the knowledge that safety is fragile. Psychologists document rising rates of anxiety, depression, and post-traumatic stress linked to climate-related disasters, many of which trace back to ENSO cycles. Communities already vulnerable economically or socially experience compounded effects, widening inequalities. In this sense, ENSO does not just deliver physical shocks, it reshapes the emotional fabric of American life. The growing recognition of ENSO's health impacts has led to shifts in public policy. State health departments now fold ENSO probabilities into annual preparedness plans. Emergency managers pre-stage supplies when El Niño floods are likely. West Coast fire agencies ramp up funding during La Niña years, knowing the risk of catastrophic burns is heightened. The CDC uses ENSO data in part of its flu season modeling, adjusting vaccine distribution accordingly. These adaptations represent progress, but gaps remain wide. Many communities still lack resilient infrastructure, adequate insurance, or strong public health systems to handle ENSO's full force. Wealthier neighborhoods can invest in air conditioning, floodproofing, or fire-resistant building materials, while poorer ones face the brunt of losses. ENSO amplifies these disparities, creating health outcomes not only shaped by climate, but also by inequality. All of this demonstrates a single truth. ENSO is not only a weather cycle, it is a health and safety cycle, determining which diseases spread, which disasters strike, and which communities are left most vulnerable. It is the invisible hand that directs where the next heatwave hits hardest, where floods contaminate water, and where fires choke the skies. For Americans, recognizing ENSO's role is no longer optional. It is essential for protecting health, preparing communities, and narrowing the inequalities that ENSO's impacts so often expose. ENSO's reach into American life extends beyond the dramatic images of storms or wildfires. It is present in the small, everyday realities of health and safety. When El Niño drives warmer winters, it changes pollen seasons, triggering earlier and longer bouts of allergies that affect millions. Asthma cases rise not only because of smoke from wildfires, but because changing humidity and mold growth follow ENSO's cycles. In La Niña years, when drought grips the west, dust storms intensify, spreading fine particles that worsen respiratory conditions in states like Arizona and New Mexico. These are not distant problems. They are hospital visits, missed workdays, and medical bills that families must absorb. For schools, these impacts show up as more absences during flu season or during periods of extreme heat. For employers, they mean lost productivity and higher healthcare costs. In short, ENSO's health footprint is everywhere, even if few recognize it. Community resilience depends on acknowledging and preparing for this footprint. Public health systems increasingly treat ENSO as a predictive tool, not just background noise. A forecast of El Niño may prompt mosquito abatement programs, water quality monitoring, and flu vaccine campaigns to be expanded. A La Niña forecast may trigger wildfire readiness, community cooling center programs, and emergency stockpiles for hurricane-prone areas. Cities like Miami, Los Angeles, and Houston are learning that ignoring ENSO is no longer an option if they want to safeguard residents. At the federal level, integrating ENSO into health preparedness strategies is beginning to happen, but unevenly, leaving gaps that disasters inevitably expose. The path forward requires not only better forecasting, but also public education, so that families understand why a distant ocean cycle matters to their neighborhood's safety. Ultimately, ENSO is a reminder of the fragile connections between climate, health, and human security. It determines whether a child suffers asthma during a smoky summer, whether a family contracts illness after a flood, or whether a community can weather the strain of a brutal flu season. It also determines whether lives are lost in hurricanes or fires, whether hospitals are overwhelmed by heat stroke, or whether water supplies remain safe. ENSO is not simply a scientific abstraction. It is a lived experience shaping the quality and length of American lives. As climate change amplifies its cycles, the stakes will only grow higher. The question is not whether ENSO will return. It always does, but whether we will be ready to face it. To truly protect health and safety, Americans must see ENSO not as obscure jargon, but as a central driver of everyday risk. By investing in resilient infrastructure, robust public health systems, and community preparedness, the country can reduce the toll of its cycles. Families, too, can play their part by heeding advisories, supporting preparedness initiatives, and recognizing that ENSO touches their homes, schools, and workplaces. If you want to stay ahead of these hidden forces and understand how they shape disasters, health, and the safety of communities across the nation, subscribe to Crisis Lens. We break down complex climate patterns like ENSO into clear insights that help you protect your future, your family, and your community.